Hello, good morning. I'm Dr. Makharadan. Today, I would like to speak on lumbar puncture. Lumbar puncture, the word itself means that you are puncturing into the lumbar area, that is the lower back. This is basically to find out any disease in the central nervous system. Like the common ones are the meningitis or the meningoencephalitis, subrectal hemorrhages, or the most commonly in the anesthetic or in the surgical side, the spinal anesthesia. So there are lots of indication for doing lumbar puncture. First of all, it's done to find out so many conditions like if you are putting a dye into the subarachnoid space, into the space, into the thecal sac, you can do a myelography to know what is happening to the nerves and nerve roots. Especially it was done in the past. Now it's hardly ever done. Secondly, to inject so many drugs, anesthetic drugs, to make it easy for surgery for the surgeon, because to avoid a general surgery, people use a local spinal anesthesia for epidural analgesia during delivery, as well as we can put some drugs like baclofen pumps, especially in case of spasticity, to infuse various chemotherapeutic agents. So there are so many uses for putting drugs into the dural space. Okay. Secondly, we can draw the fluid for so many purposes, especially once the blood pressure, the intracranial pressure is high, like in idiopathic intracranial hypertension. One of the important diagnostic criteria is the CSF pressure should be much higher, more than 25 centimeters of water. So in order to know what is the pressure, we have to do the CSF pressure manometry. Secondly, there are conditions called normal pressure hydrocephalus. So where we remove 30 ml of CSF for 3 days and assess the patient in his cognition, in his memory, his gait and his stride length and all, and assess whether he would benefit from a surgery like a ventriculoperoneal shunt. So these are the two indications to look at the pressure and to remove the CSF as a therapeutic measure. Then thirdly, we can diagnose so many conditions, starting from the infection of the central nervous system like meningitis, meningoencephalitis, or various inflammatory conditions, autoimmune encephalitis, multiple sclerosis, Guillain-Barré syndrome, and so many other conditions. The lists are quite numerous, because if you take any CNS diseases, CSS study is one important aspect. So even the virus, the meningitis can be so many, can be many bacterial infections, viral infection, fungal infection, protozoal infection, parasitic infection, chemical meningitis, or carcinomatous meningitis like infiltration due to malignancy like leukemia, lymphoma, or other malignancies. So we can remove this fluid and check for the malignant cells. You can assess that. We can have the CSF pressure monitored. We can have the CSF sugar, protein, cell type, cell count, malignant cells, various cultures, various antibodies, and various other. In the research also you can do so many things in the CSF study. So it's quite an exhaustive list. So I don't want to narrate much of that. So today I would like to speak on a particular thing. These are the indication, like you have to diagnose so many conditions, we have to treat, and you can use in anesthesia and various chemotherapy and other things. So it's rather a simple procedure. It's not a major procedure like a major surgery. So here what we do, or the anesthetist do, or the surgeon do, they put some introduce a small needle called a spinal needle, so small gauge needle, into the L34 or L45 or L5S1 with a quite long needle, and they will introduce into the theca and remove the CSF. So that will come out just like clear water. Suppose if there is a bleed into the brain, you call it as a subarachnoid bleed, you can get the bloody water. If there is a meningitis, you get a thick purulent thing, like in tuberculosis meningitis, viral, bacterial, and other meningitis. So we can analyze what's happening inside our body, whether it's any infection or any other condition which we can diagnose. Because the most important thing in neurology is we can do neuroimaging. Apart from the history and examination, we have neuroimaging like a CT or MRI, you have a EEG, you have nerve conduct study and EMG, and most importantly the CSF study. So what are the various precautions? So basically, it's a, as I mentioned earlier, it's a simple procedure. It's not a major procedure like an angiogram or surgery, major surgery and all. Here the patient either sits or lie to one side, and the person, the doctor will drape and clean that area, and a sterile condition. They put some needles and remove the fluid and assess with the various parameters. So after the procedure, he has to take rest. The most and the important thing is bed rest, bed rest, bed rest. It should be at least for 2 days, 24 to 48 hours, either in the lateral position lying to one side, or in the prone position, or at least in the supine position, like as you sleep normally, lie like this. So, and he should take more water, at least 2.5 to 3 liters of water, I mean depending on the condition, and avoid prolonged standing or exercise, because it's a common practice in some centers to do early exercise. Exercise is always beneficial, whether it's during surgery, after surgery, or for any condition. But if the patient has undergone these spinal procedures, you should be cautious, because sometimes there's a condition called the CSF leak or which cause post-dural puncture headache, because the CSF can leak into the tissues in and around the back and these muscle planes and tissue planes, which would drag the brain structures down into the spinal canal, which cause severe headache. It's called intracranial hypotension. So, and the whole condition called post-dural puncture headache with this complication. So, in order to avoid this complication, the person should take rest, and the practitioner or the surgeon or the anesthetist should strictly enforce the patient has to take rest onto one side or on the supine position for 24 to 48 hours. And if they make them exercise or walk unduly without any supervision, this would give rise to a particular very pathetic condition, the severe headache in the occipital, in this area, the occipital headache with nausea, vomiting. Sometimes it can lead to fits. So be careful. So after a spinal anesthesia, take rest for 1 to 2 days, take more water, avoid ambulation, avoid exercise. You can always move the legs and do the other tests, but not walking, not other exercise, because the CSF can leak, especially if the person using a thick board needle, if they remove too much CSF, and especially, or if there is a pressure high in the brain due to some conditions. So this is of utmost importance. So supposing that the patient still continue to have headache in spite of bed rest or hydration, simple analgesics, we can use other drugs like indomethacin, short course steroids, and saline and all. Still, if the headache is persisting, we can use a epidural blood patch, where two anesthetists or two people take the patient to the theater, and one will take blood under sterile condition from the cubital area, and the other person will keep the patient in the left lateral position and inject the blood for the same patient into the epidural area, where they seal off the defect or any tear or any CSF leak. So it's done very efficiently, and the results are fairly fantastic, maybe almost 90 to 95% efficacy. So my talk is not to mention this epidural blood patch, but to tell you that this is a common procedure, and you have to prevent complication, unnecessary complication. I mean, not this, especially if the patient walks about, or if the patient is not instructed by the consultant that he should take rest after a spinal procedure, is a disastrous condition. So always instruct your patients, and the patients and relatives should know that after LP shouldn't walk for at least 1 to 2 days, but they can do other exercise, like they can move the limbs, they can do other simple exercise, but not walking or ambulation. So okay, thank you very much. Bye.